Corey at echonmfap@gmail.com to let her know that you are interested in receiving CEUs for a session. Today's topic is Introduction to CYFD's Safety Assessment Tool. And our presenter is Ashley Williams, who is a County Office Manager for CYFD Albuquerque Metro Office 4. Ashley is a licensed clinical social worker with a Master of Social Work degree from New Mexico Highlands University and a Bachelor of Science in Psychology and Biology from UNM. She has worked in Child Protective Services for over 10 years, as well as 2 years in hospital social work. Ashley has several years of supervisor and management practice. She has participated in several initiatives through the course of her work at CYFD. She is currently a county office manager and has begun supervising master level social workers for the purpose of clinical licensure. The New Mexico Children, Youth and Families Department recently implemented a new practice called Safety Organized Practice. Along with Safety Organized Practice, a new safety assessment was introduced. In today's training, NMFAP practitioners will gain initial understanding in the following: what Safety Organized Practice is and the approach's history, values, and components, how Safety Organized Practice components link to other CYFD initiatives and practices, such as the structured decision-making system, team decision-making, trauma-informed practice, etc. And lastly, the Safety Organized Practice case consultation process through use of the Collaborative Assessment and Planning Framework, or as we know it, CAP staffing. We'd ask that you please fill out the post-session survey, which is an integral part of our program's data collection efforts under the federal grant. The survey will take only a few minutes, and Jen will post the link in the survey in the chat box, and we thank you in advance for your feedback. And I will hand it over to Ashley at this time.
Hello, everyone. I am going to be sharing a PowerPoint with you guys. I am going to be skipping through several of these slides as we go, as this is typically a 2-hour presentation. But in order to get to all of the objectives, we'll be looking at the safety assessment and not going into the risk assessment at this time. And then I'll leave an opportunity for you all to ask any questions as we go through this. We'll ask those at the end in order to tie up any of the loose ends. So yes, I am Ashley Williams. I am a county office manager here in Bernalillo. We have 5 county offices in the metro region. And we, about 2 years ago, a little less than 2 years ago, went through a restructure. We were organized into 2 county offices of permanency planning, 2 county offices of investigations, and a county office of placement. At this point, each one of our offices has investigations, permanency planning, and placement within our offices that matches the structure of all of the county offices through the state. And then 3 out of the 5 of our offices also have in-home services practitioners in those. CYFD has been using Safety Organized Practice for several years. We rolled out CAP staffings prior to 2017. We've been looking really at a whole shift in how we look at safety practice. And the safety tool was remodeled and rolled out as well in the last couple of years. The goal of all of that is to really look at updating all of those. CYFD safety tool hadn't been updated for close to a decade prior to that, and our risk assessment hadn't been updated for quite some time even prior to that. So we're looking at making sure that the decisions we're making are really looking at the outcomes and the impacts that parents' behavior or caregivers' behavior has on those children. So overall, Safety Organized Practice is going to be utilizing working relationships that we have with our community providers, our families, our foster families, therapists, attorneys, and everyone that involves these children that are within our custody. Really looking at critical thinking and decision supportive tools. One of the things that our staff will say after they've been trained is the tool doesn't make the decision. It's really looking at the whole picture, and the tool is a piece of that. And then really looking at the plans that we're developing in order to help parents enhance that daily child safety as the caregivers for them. So when we look at our safety decision-making tools, we look at what surrounds a family and looking at what makes them safe. It's not just a tool, it's not just one worker that is assessing the family, but it's really that engagement piece. What are the providers telling us? What are the workers experiencing? What are the foster parents experiencing? What do the staff who supervise visits experience? So what does that engagement look like? We look at professional judgment of our staff who all experience this training and what it looks like for children to be safe. We look at those structured tools that we use with our safety tool and our risk reassessment. And then we look at the research on what we have. And really we look at making those decisions as we go on a case. They're done at a point in time. However, those are things that we're assessing throughout the life of a case and the entire time that a family is working with the department. So our goals when we have these structured decision-making tools are going to be to promote safety. They're going to be to reduce the harm that children and families experience. And then we're looking at expediting permanency for our children, and that's any permanency, but with reunification being the first and most sought after goal, to do it safely is really the goals that we've established in these tools that we're using in looking at safety organized practice. It's really assessing what makes a child unsafe with their caregiver and then figuring out what we have to do from that point. So looking at this slide, what we see is that all of the information about a family is in the lightest blue section, kind of in this area, the big piece of it. That includes everything about their family, everything about their history, anything that's ever happened to the entire family, and including all members of that family. Now, between any of the providers in this call and CYFD, there's going to be a smaller section of that that's actual information that we gather. But even some of that is extraneous, and it's not necessary for us to utilize all of that information that we need to make a decision. Where it gets complicated is when the information that we need to make those decisions isn't included in that information learned piece, then we're missing pieces that really need to be provided so that we are able to appropriately make those decisions. So this is kind of the way that CYFD is looking at our structured decision making, is being able to tailor down and kind of extrude some of that information that's not necessary to make those decisions, but really look at what factors are influencing safety for children. Again, I had alluded to this prior. Tools don't make our decisions, we make our decisions, but our tools help us to make those decisions by having structured definitions for our danger indicators and our complicating factors. It allows us to really determine what we're looking at and what we really need to focus on helping a family. I know that in the past, CYFD has said that parents will have to submit financial plans. And I think that helps us understand when we walk away if a family is going to be safe and stable, but it may not be a factor influencing safety. So, really looking at what are those actual pieces that influence the safety of a child, making those the priority for our families while we work on supporting those other risk factors around housing or financial stability if those parents can be safe without those pieces in place. So this one is a fun one for people, and I know you are all on a variety of different electronic devices, so you may not be able to see this. But for those of you that can see this, if you're able, what are some of the things you see in this pictogram that would make these children unsafe? Just wide shot, anything in the chat box. What makes the children in this diagram unsafe? I see a knife, I see electric plugs, bottles on the couch, the heater there. An iron. So those are some of the ones that seem to be consistent with all of you. Now, how else can we look at this situation to determine what makes these children safe? A parent is present. There's food in the home. Susan asks, what is the quality of supervision by the parent who's sitting on the couch? So those are all the things that we get into for gray areas. Um, there's actually somewhere that they are at home. When we do this with our CYFD new staff, they come up with a whole lot more negatives than even you guys have. They look at the cracks in the wall, the stuff leaking out of the garbage can. There seems to be a toddler on the floor curled up in the corner. They mention the iron, the knife, the bottles. There seems to be an ashtray that some people can see in the far corner. But what we have to look at is that safety is not stagnant, and we can't just look at a photograph and determine, oops, sorry, um, what is actually safe or not. We have to talk to the people involved. We have to look at what supervision is the adult providing. The kid that is closest to the knife, is that a risk for that child, or is that child old enough to know that they shouldn't be wandering around with the knife? Is the iron on when it's plugged in, or is the iron there despite that it's a heavy object and we might need to have a concern about it? What is it that actually makes these children safe or unsafe? And that's the part of that judgment and those assessments that go into it. Anyone can take just a snapshot in time and start to pick it apart to say what is positive or negative. We don't know if the bottles on the table are soda bottles, if they're alcohol bottles. We don't have that information by just looking at a stagnant photograph. So really diving into that a little deeper when we do our assessments is where we get to being able to answer the questions on our safety tool. So the definition of safety that CYFD is using and that is utilized in our safety tool are actions of protection taken by the caregiver and their network that address the danger and are demonstrated over time. This is one of those areas that frustrates some of our families because we need to see it over time. It can't just be one act of, well, they filed a restraining order and therefore that is absolutely and 100% safe at this time. We really have to see what they and their network, because network is a huge part of where CYFD is going with our safety organized practice in helping to keep families safe. We recognize that children aren't raised within a vacuum, and that it does take more than a parent typically to raise children and to have safety and success in doing so. We all have at least one person in life that we can call. They may not always be the safest person, or we may not feel confident to leave our children with them, but there's at least one person that that parent knows that they can call and vent to. And from there, we can continue to develop those networks for our families to look at what is safety. But these are actions by parents, so it's something that they have to do or to stop doing. And we have to look at it over time. It can't just be a point in time. When we look at this slide, this helps us, it's actually pretty despised with CYFD at this time because we use it in all of our SDM trainings in a variety of different ways. But when we look at that danger versus risk, and you're driving down the road and you see that sign where there's possibly deer in the area, it prompts you to be aware. It prompts you to maybe slow down a little bit, to keep an eye out, to really just know that you may have to take some type of action while you're driving, which is what we're really looking at for risk. It's that stuff that we know is on the periphery that can turn into danger, or it can turn into something that we have to immediately address with the family. But if all we're seeing is that sign that there are deer in the area or that those risk factors are present, it doesn't necessarily mean that children are unsafe. It means there's a risk that they could be unsafe. The danger of what we're looking at is imminent. That deer is right in the road, right in front of you. You're driving down the road and you have to do something. Otherwise, you and or that deer can be in a really adverse situation. So when we're looking at danger as it pertains to our safety assessment, we're looking at what is happening right now. This is one of those point in time situations where we need to do something. We can't walk away from this situation with the way that it is right now. And when we're looking at kids who are in care, we understand that that danger indicator might not be present because those kids aren't in the home, but we need to address it and we need to have those parents show us those actions of protection in order to know that when those kids go home, they will be safe. So when we're looking at that imminent danger to the children. There was something imminent that caused them to be removed from the home. And those are the pieces that we have to address before those children can be safely reunified and safely placed back in that home. We have to look at what planning needs to go around that. We have to look at all of those factors involved when we're looking at that. So the next question that we ask if there are those danger indicators are what needs to happen, what needs to be in place for those children to be back in the home if they've already been removed. Our current safety tool has 5 different sections on it. It has a section regarding vulnerability. When we're looking at vulnerability, these are kids who don't have the same ability to self protect as some of the other children that we work with. Some examples are children who are under the age of 5, children with diminished developmental capacity, children with maybe some motor skills deficits that require more action from their caretaker. And we know based on what we look at with those tools that those are the children who have higher risks for being maltreated because of those delays and because of the challenges that a caretaker might have in parenting those. Those factors that influence vulnerability aren't the ones that indicate a danger indicator. It's one of those like yellow flags that we raise that says, hey, we need to look at this and make sure that these are addressed. Our danger indicators are that deer in the road that says something has to be done right now. Our complicating factors are those areas that can complicate a parent's ability to safely care for their children. The complicating factors we're looking at are along the lines of substance abuse, domestic violence, the parent's mental health concerns, because we know in and of itself that the danger indicator isn't that there is a substance present in the parent or in the environment. It's that the home is inappropriate or the parent's ability to supervise is what creates that danger indicator that is complicated by something like substance use. We then look at the safety planning capacities and interventions that are possible, and then that will guide us to the safety decision. I'll be able to look at the actual safety assessment and those danger indicators. It was sent in a handout for you all, but we can review that at the end specifically if time permits. So this is what we're looking at. We are looking at, is there an imminent danger for children? If the answer is no, that child or children are safe. CYFD doesn't have to take further action with those children regarding an immediate action. If there's risk involved, we might have to look at services or that type of intervention. If there is an imminent danger of serious harm, are those families able to plan? Those are cases that we call safe with a plan. If the caregivers aren't able to take protective actions or those actions aren't sufficient to mitigate the danger indicators, those children are unsafe. And our tool tells us that that warrants a removal from the home if we haven't been able to plan otherwise, or if we did have safe with the plan and then all of a sudden that plan is no longer able to be implemented and we haven't seen those danger indicators diminished, then we come back to children who are unsafe. For any of you that remember our old tool, it had a conditionally safe there that has been completely gone from the way that we're looking at staff. We don't think children are safe under certain conditions. There either has to be a concrete plan in place or children are unsafe when danger indicators have been identified. So safety planning is a tool that the department is using really to prevent removal of children. I am going to kind of skim through this a little bit more quickly because the children that are in custody we're not doing a safety plan with because we've determined that they're unsafe and that plan is not appropriate at the time we file for custody. Not that it could never be, but really what we're looking at with our safety plans are changed actions that indicate a changed behavior, that it responds very clearly to the identified danger indicators. And our safety plans are to be short term. We don't want a safety plan in place longer than 21 days. And if we have to review it at that time, we can look at it. But these should be very short term solutions to mitigate the danger indicators so that once that safety plan is over, that parent then has what they need to be able to move forward without the department's intervention. Our safety plans must include a family network and older children, and this has to be someone that's not involved in the initial allegations. There's a backup plan and how we're going to monitor it, and it designates a clear time for a review. So for the purposes of this training and in MFAP, you guys are working with families who are already working within the legal system. And we're not implementing those safety plans at the beginning because there wasn't the ability to do that plan that indicated that the department needed to file for custody. And our respite or out of home placements should be 5 days, not these long term safety plans where children are just left with a relative and the case is closed out. We're really focusing on parents being the ones to provide that care for children and not just having them um, left to another relative with no supports in place. One of the things that we are saying is that safety does not equal services. So if this is a bridge that we're trying to cross and we're trying to get to the other side of this stream or river to be safe, services are a path to get there. Services are not what gets a child there. A parent participating in X number of sessions does not automatically indicate that they're safe to parent their children. We have to see that changed behavior over time in order for CYFD to really assess that parent as being able to mitigate those danger indicators or overcome those danger indicators. This is one that every parent I've ever talked with at a first meeting says, how long will this take? And what do I have to do to get there? We have to change behavior to get there. We have to make sure that you can safely parent your children. And there are a variety of ways to get there. Services are one of those ways, but there are also a lot of non traditional ways that our families can get to being safe that don't involve necessarily a direct route through a traditional service provider. But again, services and going through X number of services are not going to be sufficient for CYFD to say, oh, well, they completed this, therefore their children can go home. It's those behavioral indicators. We've known lots of families that get halfway through their services, and we are starting to see those behavior changes well before they complete services. And at that point, we should start looking at what needs to be in place for a possible trial home visit, or what's the next step for that parent in order to be safe with their children that isn't necessarily those check boxes in completing services. This is one of the things that we're saying, no network, no plan. And this is going to be true for even our families who have children in our custody. One of the things that we have seen through research is that families who have a network, families who have the ability to have someone when crises are happening, do much better and stay out of the CPS system than other families. When those networks are diminished, when they're frazzled and families don't feel that they can reach out to each other, or they don't feel like they have anyone, they feel like they're an island unto their own, and they really have a hard time figuring out how to plan when things come up that are unexpected. So really what we're looking at is who is in that parents network that can really help them if they have a really bad day. Any of you that have been parents on this meeting know that sometimes being a parent can be really challenging even under the best of circumstances. And a lot of the families we work with don't have the best of circumstances to start off with. And so if they don't have someone they can turn to when they're having a really bad day or just need to talk about how do I do this differently, we know that they're not going to be as successful. So one of the things that we have seen with NMFAP is that they can really be supportive in that network and help that family to develop an even more extensive network that supports them in being able to keep their children safe. Because if families could have been safe without that network or without them, then CYFD wouldn't be involved. So this is again regarding safety plans, but they have to change over time. And this is going to be the same with the families that we're working with in our permanency cases, even if it's not specifically a safety plan, but that treatment plan is going to evolve to meet the needs of the family. So when we have those assessment plans that indicate that we need more information, we're going to then develop their treatment plans based off of those assessments. It's the same situation with a safety plan, but we have, when children are in a foster care setting and they're not back at home with their families, we learn different information about that family that might cause us to look at what needs to be put in place, or what we thought was a danger indicator might be more of a risk factor so that we can continue to work with that family. And we know stuff happens on trial home visits. We have unforeseen circumstances when kids are at home. Things can change. And so really to get that plan for the family, that's a plan A, plan B, plan C. A lot of our families are used to living for right now, and that's not a normal experience for them, being able to have those contingency plans if things happen. So that's part of what we're working on in the safety planning process, but also through those treatment plans and while we're working the reunification plans. This is specifically regarding respite. And these are kids who are not in CYFD's custody. CYFD's respite for foster families is different than this definition. Um, I mean, it's the same definition, it's just for different periods of time. When we're looking at safety planning respite for kids who aren't in our care, we're really wanting that to be 5 days or less that children are out of the care of their parents. If it has to be longer, that's when we're looking at alternative forms of long-term care for those children, or looking to see if they need to be in CYFD's custody. So this is another depiction of that harm versus risk versus danger. The green line is needs. So this is what a family needs. It could be related to risk. It could be related to danger. It could just be something that's a small barrier for the family, or it needs to be assessed and developed further on a case plan. Risk is what indicates further likelihood that that family is going to be involved with CPS. Those are those factors, and some of them can be stagnant factors, meaning that they can be ongoing life factors that aren't ever going to change. If a parent was in foster care as a child, that's always going to be a risk factor for that parent, even if they've made changes in their life to where it's not impacting them right now. And then there's those current factors for risk that can heighten or decrease those levels. And then danger, that's that stop sign. We need to do something right now to make sure these children are safe, because we can't walk away from this situation. Again, risk versus danger. We see this
Ashley,
slide all
I
the
had
way.
a question as to
Okay.
she wanted to know if respite can be done prior to filing a case.
Yes. So during the course of an investigation, if there are concerns, that are leading the department to feel that there is a danger indicator. That's part of that safety planning. And respite can be included in that plan, but we're really focused on it being short term. But yes, respite can occur. CYFD is still doing the same kind of checks that we've done in the past. We want to see, does that person that is asking to be a respite provider have some type of violent criminal history? Is there something that would make us just as worried or worried if that person um, was to be that respite provider? So we're still doing our checks on those individuals, and we're looking at a home visit there as well, just to make sure that the physical safety of that home is appropriate. And in that plan, there also needs to be the ability to say, if that person is for some reason unable to care for these kids or something comes up, what do they then do? And that's one of the ways that it's very different than the safety plans we were writing before this new tool and the new safety plan rolled out, is that we weren't giving families those provisions and we were kind of leaving them to figure some things out on their own. And really, we want to be more in the driver's seat with those families, helping to steer them in the right direction. But once we have legal custody, that changes the definition of placement and all of that. So we're not looking to do those respite placements after we have custody. We're looking to license that as a relative, those individuals as relative foster parents. Did that answer the question of whomever asked it?
She says, yep, you're good.
Okay. Sorry, I can't see the chat box and the slides at the same time. Again, risk versus danger. Risk is that sign saying, hey, you need to pay attention to something. Danger is that event or circumstances that you cannot walk away from without doing something differently. Our SDM risk assessment, this is what we're going to look at for different kind of that. I might just briefly run through a couple of these slides, just so there's an understanding of what it is and how it's different than safety. But our risk is about likelihood. So it's about the likelihood that a family will continue to be involved with CYFD. If we know at CYFD that a family is high risk and has about a 1 in 2 chance of coming back to our attention, we need to help that family with something like warm handoffs to services, maybe in-home services, something, because otherwise there is a significant likelihood that that family is going to be coming back to us. And we know families don't like us, by and large, and they don't like us showing back up to their house to say, why are you here again? We thought we dealt with this last time. So when we look at risk in that way, we can have those different conversations with families when their children are still in the home, because risk and safety are two separate issues. A 1 in 6 chance is about the likelihood of our moderate risk assessment, and then 1 in 12 is about the low ratio for that. So if we have a family that has a 1 in 12 chance of coming back to the department and we've determined that the home is safe, we can provide them with some information, but we're not maybe going to do the same warm handoff that we would do for a family that's got a high risk assessment. And our risk assessment, again, looks at neglect and abuse indices. So what is the current assessment for? It looks at a scored risk level. There is the ability to override a risk assessment if certain factors aren't present. And then it looks at a final risk level. And we can briefly skim through those with the handouts. But again, our investigations, this is the risk assessment tool is used in investigations only. The risk reassessment tool is used on any other risk reassessment. And that tool is currently being modified, but isn't quite ready to be rolled out yet. But for our investigations case, if there are no unresolved danger indicators and we have a low or moderate risk level, we're going to be closing those investigations. If we have danger indicators, our risk assessment is not the driving factor in what we do with those families. But if we have a high risk level, we need to be providing some type of ongoing service to that family. And it can look like in-home services, it can look like warm handoffs to community providers, connecting families who might have tribal affiliations or cultural differences or communities to those communities to help them with decreasing that risk. So one way to look at some of the differences are to look at the safety assessment telling us what we're worried about, and our risk assessment tells us how worried we should be at that ongoing involvement with the department.
So Sherry asked a question. She asked, should a risk assessment be used to determine whether children should be taken into custody?
Never. Our risk assessment tells us, and I'll go over these when we look at them briefly, but if there isn't a danger indicator and the risk is high, we should be looking at other services for those families. If our danger indicator, if there are any danger indicators that come back, that's us telling us, stop, we have to do something. Whether it's a safety plan and additional services, working with the family and their network, or filing for custody. We do talk about risk in our cases, but we have to be looking at safety as the reason to file. We talk about danger indicators and being high risk, but we should not, without a safety tool saying that children are unsafe, we should not be relying on that risk assessment in and of itself to look at removal for children. And this might be difficult to see because it cuts off some of the bottom. But when we look at our safety matrix, this is what we're looking at. So when we have children who are unsafe and then the risk goes even further over there, if they're unsafe and they're low risk, foster care placement is indicated. If they're unsafe and moderate risk, foster care placement is indicated, and that we may be able to return those children in a moderate amount of time. If they're unsafe and high risk, a return home is likely to be much more complicated. So really that the risk assessment doesn't give us the overall concerns about the children being safe in the home. It gives us the risk that we're going to stay involved or become involved again. So when we're looking at our service matrix, if children are unsafe, foster care placement is warranted. Whether it's a relative foster care, if it's a non-relative foster care placement is what we're looking at when children are unsafe. Because safe with a plan would indicate to us that that family and network can work on this situation without them needing to be in foster care.
So Sherry asks, is there a policy or procedure which states that a risk assessment should never be used to determine whether a child should be taken into custody?
I would have to go back and look at the exact policy around the safety tool. I don't think it's going to have the language that states could never be used. I think you're going to look at the language of what is required in the safety assessment first. Because our safety assessments should be done within that very short time frame. If children are removed from care, that safety assessment should be being done at that point in time. Our risk assessments aren't required to be done for the first 30 days because risk is determining the chances of us being involved in the future. And when I go over the actual the tools with you all, you might be able to see that a little bit different so that you understand what we're looking at with the safety tool compared to our risk assessment. And that might help some of those questions. And then some of the practice changes that we've really implemented with the department has really been that conditionally safe exclusion from our safety assessment. Our respite time is really trying to be capped at 5 days. We really are integrating the networks. And then that service matrix is a little bit different than the one that we have. And our risk assessment tool was really tailored to look at the cases in New Mexico. They took 18 months to look at that when they were designing that. So I want to shift gears now and go from the PowerPoint to the actual tools so that you guys can see what we're looking at in those differences. If you'll give me just a second to pull them up. Okay. So this is going to be some of the basic information. The top part just gives us who is involved in the family, who the worker are, their case ID within our system. It's all just demographic information, and then who the children are that we're assessing. When we look at those factors affecting the vulnerability, what we're looking at is children who are between 0 and 5, and those vulnerability capacities are for a number of reasons. These children aren't school aged yet, so unless they're involved in daycare or early intervention services, there are typically less eyes on them from the community to report if there are ongoing abuse or neglect concerns. A child who has significantly diagnosed medical or mental disorders are going to at times be harder to parent. So that is one of the reasons that we look at that as a factor that impacts vulnerability. It doesn't make a child unsafe in and of itself. Again, not readily accessible to community oversight. This is why some of our investigators will get concerned when parents say they're homeschooling, because it could mean that those children aren't accessible to community oversight. And if those parents aren't really able to show us how they're homeschooling and all of that, it makes us wonder if their needs are being met. But it can be one of those vulnerability capacity areas. Diminished developmental or cognitive capacity, and then diminished physical capacity, limited use of limbs, non-ambulatory, and that's past an age appropriate level. We wouldn't check that box for a child who's 4 months old, who's not normally developmentally at a point where they would be crawling or engaging in appropriate developmental activities. And then when we look at the danger indicators, um, these go into a lot more depth than some of them in the past. The system that our staff use does give a few examples of them so that we can kind of do that, but they're not all inclusive. So our danger indicators are assessed for the household where there are allegations. If we're filing for custody, we're looking at all parents in those cases and the ability of any parent or legal caregiver to the child to be able to supervise them safely. Our first danger indicator is going to be that a caregiver has caused serious physical harm to the child or made a credible threat to cause serious physical harm, as indicated by one of the following. So we have to look at a serious injury or abuse to the child that's not accidental. If we have those situations where you have injuries to a child that's not consistent with the way any adult or caregiver can explain it, that could be one of the items checked on this item. If a caregiver tells us they're afraid they're going to hurt their child, this is one of those times where we have to look at this, because if a parent is telling us that, that is extremely serious. Um, I've not heard that very often from parents, but when we do, we have to take that serious. If there's been an actual threat to cause harm to the child, if there's been domestic violence likely to injure a child, we can check that box here, and then excessive discipline or physical force. So this is one of the danger indicators that we have. And when we're out at the home, we're not looking at something that said, oh, well, a year ago, I spanked my child with a belt. That is clearly not going to rise to a current danger indicator. But if we have a child with marks all over their body and they're saying, well, my parent hits me with a hanger or a belt, that's an injury to a child. When we have children who are younger and we have those serious injuries, this is going to be one of those danger indicators. And when we can't determine who inflicted those injuries, it rises that level here. Our second item is child abuse, child sexual abuse and or exploitation is suspected, and circumstances suggest that the child may be in imminent danger as a result. So this is one of the items where we very clearly have to have the and. So it's not just that we have a concern about this, but we have to expect that that child is going to be in imminent danger as a result. The third item is the caregiver does not meet the child's immediate and basic needs for care, supervision, food, clothing, and or medical or mental health intervention, and the child has been seriously harmed or is in imminent danger of being seriously harmed as a result. This is the item I think we see checked often, one of the often ones, because it's that it's kind of the one that captures more of our neglect. And we're looking at filing in these cases when that parent is still unable with the support of a network to meet those needs, or if those kids are really on the verge of being hurt as a result of their situation. The physical living conditions are hazardous and imminently threatening to the child's health or safety. Some of these we also tease out a little bit. If you have a toddler who's just learning to walk around and puts everything in their mouth, this may be a danger indicator for that child, whereas a 16-year-old could be in the same home without it rising to the same level of danger indicator. Because we really need to see what that impact is on the child. Not to say that the house may have uh, unsanitary conditions, but a 16-year-old's not likely to put everything in their mouth, whereas a toddler may walk around ingesting animal feces or whatever they might find lying around the home. 5 is the caregiver acts towards a child in negative ways that result in severe psychological or emotional harm, and these actions result in the child being a danger to self or others. So when we see kids who've got severe patterns of needing to be hospitalized, and when we figure out that those ways are due to emotional harm from the parents, that's when this becomes a danger indicator. The caregiver is unable or unwilling to protect the child from serious harm or threatened harm by others. Um, Number 7 is the caregiver's explanation for a child's injury is questionable or inconsistent with the type of injury, and the nature of the injury suggests that the child may be in imminent danger as a result. So, number 1 and number 7 can go hand in hand if we still don't have any credible information for those disclosure or for the injuries. The family refuses to allow CYFD access, or there is reason to believe that the family is about to flee is another danger indicator. Current circumstances combined with information that the caregiver has or likely has seriously maltreated a child in their care in the past suggest that the child may be in imminent danger. And when we look at the further definition of this on our end, it's not as broad as that would sound to say that there was simply a substantiated allegation and now we're always going to check this danger indicator, but we really have to look beyond that. And then there is an other, which we don't like to use often, but there's rarely a case that falls into this. We reduced this safety tool by about half when it was rolled out. If there are no danger indicators present, the child is safe. That's as far as we go on this tool. We stop there, we do our risk assessment, and we finish our investigation. If there are a danger indicator or danger indicators identified, we keep going through the tool and we look at complicating factors. So these factors are regarding the parents. And we're looking at the danger indicators that would impair or that we would need to pay more attention to in order to help a parent resolve the danger indicator that was identified. Those are substance abuse, domestic violence, mental health, a developmental or cognitive impairment of a parent, the physical condition of a parent, or other. Again, we left other in there when we were assessing for this. Most of our complicating factors are in one or more of those already identified danger indicators. When we look at safety planning capacities, so this is what takes us from unsafe to safe with a plan, is the caregiver capable of participating in this plan? Do they have the mental faculties? Are they able to maintain sobriety to the point where they know there's a plan in place and that we can work on it? An in-home safety plan is not the same thing as in-home services. An in-home safety plan means that we're still working with that family while the children are not in our legal custody. Is the caregiver willing to participate in a plan? Does the caregiver have at least one supporting adult who, John, I'll answer your question in just a second. Does the caregiver have at least one supporting adult who was not involved in the allegation and supporting adult is willing and able to participate in this plan? All 3 of these have to be checked in order for us to move forward with developing a safety plan. And John, as far as mental health issues, some of this is looking at what that parent tells us. And sometimes we may not be able to identify that it is a complicating factor if there are other things going on. And remember that complicating factors aren't the thing that identifies that a child is unsafe or not. It could be a gray area until we get more information or get a further assessment by a licensed mental health professional. But a lot of times families will tell us when we're investigating that they have a diagnosis of depression and that they haven't been able to get out of bed, or they'll provide some of that information. So at this point in that snapshot of time, we're looking at what they've reported, um, and or what we've kind of seen behaviorally. Um, and yes, need a separate assessment should be filled out for each household if the parents are not residing together. Um, and then if we look forward to what our plan would look like, we would be looking to check who will be staying in the home, who might be leaving the home, who would be looking to move to a different place. There's all of these different boxes that we can check, but each assessment should be done for each safety plan should be done for each family individually. And when we've gotten to cases where children are unsafe, um, that's when we're looking at unsafe here. One or more danger indicators are present. A safety plan was considered but could not be created. As a result, placement is the only protective intervention possible for one or more children. Without placement, one or more children would likely be in danger of serious harm. This is what the safety plan currently looks like. I'm just going to skim through this so I can give everybody a chance to ask additional questions. But it's looking at what are we worried about if nothing changes. So this is really taking a step back instead of just saying that mom's substance use creates a problem for the family. This is saying that if nothing changes, the department is worried that Johnny will be severely hurt because mother's supervision is inadequate during time she is heavily intoxicated, or that piece of it. So it captures the supervision piece that we're worried about. It captures the complicating factor of substance use, and we're worried about the child being harmed either again or as a result of. That's a very, very basic version of what our kind of descriptions are, but that's just one of the ones that we're looking at. So we really need to help the family understand why we're worried and what else could happen if we don't do anything.
Actually, let me interrupt you real quick. I just want to remind everyone that it's 12:55. So if you need to log off at 1, this is your reminder, but we will continue until 4:15.
And again, when we have safety plans, these are cases that aren't likely to rise. They don't rise to that legal intervention. Although a safety plan may have been put in place prior to um, a legal intervention. And then we're looking at what action steps need to be taken to ensure the children are safe and who will be responsible for ensuring that that action occurs. We ask for any children that are appropriate to participate in this to sign off on it, the worker or supervisor, other network participants, caregivers, and legal guardians. And then this is one of the things that's new for our safety tool or our safety plan is who do they call if this isn't working? Again, these should be 21-day plans at the most. But who is it that they need to call if this is just falling apart so that we don't have situations where we just say the safety plan failed, nobody reached out, everybody assumed it was their own responsibility. So we're really trying to be more proactive in that. The next several pages are going to go really in depth at the danger indicators, and I'm not going to go through these because you guys can have I believe that the handouts will be provided as well. But these are the definitions that we're looking at, and there are several pages of them regarding those more in-depth definitions that are just in the other part. And I want to just give you a really quick view of the risk assessment so you can see how they're very different. So our risk assessment is really just looking at what the history is, what the current situation is to determine kind of that likelihood of involvement from the department in the future. So how many prior investigations has the family had that have involved neglect? None, one, or two or more. They looked at, like I said, 18 months of our investigations and the factors that influence those families, and looked at that longitudinal perspective to see who came back to our attention and who didn't. And that's how they got the scores and the assessment for this. Again, number of prior investigations for abuse. Um, and then has the family ever received CPS services? So some of these are just yes or no's. That it all tallies at the end. And then the current response. Is this current complaint for neglect only, abuse only, both abuse and neglect? Um, how many children are in the home? We know that if there are 3 or more, that can stretch the capacity of a parent to meet the needs of those children. It's a risk factor though. It's not, and it doesn't automatically mean kids are safe or unsafe. And then age of the youngest child in the home. This is different than the vulnerability factors in the safety assessment, because what we saw when we assessed New Mexico's data is if kids are under the age of 10, they can have a higher risk of coming back. But when you look at the actual score, having a child under the age of 10 doesn't increase your risk. If you have a child 10 or older, it actually decreases the risk. So that's one of those ways that this tool looks at really clearly what is it that influences that in positive or negative directions. And then we look at the child characteristics. Neither of the below is present, or one or both is present. Mental health or behavioral problem, and then a developmental disability. And again, as this is a risk assessment that's done during investigations, a lot of this is by the family's report, um, or what we've assessed from collateral contacts or collateral information as far as the children, which could include their school, it could include therapists, it could include a variety of community providers. Um, Either caregiver employs or previously employed excessive and inappropriate discipline. We're going to look at our substantiated reports. We're going to look at what the family discloses in this section. And then if it's yes, and it's current or prior, that's going to have the same overall abuse score, but it just helps us to look at whether that's an influencing factor or not. Either caregiver meets basic needs for food, shelter, or medical care. If the answer is yes, it doesn't impact their risk. If it's no, then it impacts the neglect score. Does either caregiver have a past or current mental health problem? And again, as this assessment is done during investigations, it's going to be by the disclosure of the parent or by collateral information. And the same with drug or alcohol problem. Um, and then some of these are just an ability for the department to see if we do a reassessment of this tool in a year, are some of these substances, if we check the boxes, going to actually impact the risk score so that this can be a more dynamic tool for us to use.
Actually, can I ask, is this done for all investigated cases? Tools? And are those made, or do we have access to those at like IPAC?
These would be a part of the case file, so that may be a question for the discovery phase when we're looking at that. I don't know if it would be at the IPAC at that point, because sometimes the investigators are wrapping everything up and it might not have been approved by a supervisor. But again, this risk assessment isn't what determined whether kids came into custody. The safety assessment absolutely would be completed by that point.
Thank you.
And then the primary caregiver has a history of abuse or neglect as a child. This is going to be one of those static factors that if it happened, and it's always going to be a risk factor. It doesn't mean that parents are unsafe. Did the primary caregiver disclose an arrest record, or did we find out about one? And some of these are, just so you guys are aware, we do look at them because some of the items say either caregiver, and some are primary caregiver. And then does the household have a domestic violence history? And when we look at those, it tallies it up for us. There are a few overrides that we can do in the risk assessment regarding sexual abuse, injuries to infants, sexual exploitation, labor trafficking, death of a previous child or current child would increase our risk level to a high. And then for some of these supplemental items, these are areas that the department has more questions about, but that we don't have enough information to determine whether these are factors. And these are not calculated into any of our risk tools at all. But if a child identifies as having a non-normative or an alternative gender identity or sexual orientation and the parents have difficulty with that, could that be a risk factor? So these supplemental items are ones that we're gathering information on to determine how that could impact future cases, but these are not assessed when we're looking at that. And then again, this is going to be, those definitions are in here that goes into a lot more depth instead of just saying, well, I think so, but my coworker says no. These boil it down for us quite a bit more to be able to say, this does meet the definition of this risk item, or you would check no. And I believe you have those as well. And our risk reassessment item, our tool is being revamped. I just haven't heard anything on when that might be coming out. So I believe you posted all of those. And I wanted to give you guys, it looks like we left about 10 minutes open for questions or further discussion. That was fast, sorry. Usually I co-facilitate that and there's a lot of time for participant involvement, but.
I did have a question, and it was just from the very beginning of your presentation. Mm-hmm. You're talking about looking at the different factors and as engagement being one of them, and the foster parents' experiences with engagement with the parents. What does that look like?
So it's more of how we get everybody to engage together instead of having these silos into, oh, well, we look at the foster parents' views. It's really about the community's engagement with those families in order to ensure that we're working together for the same goals. So it's not that, oh, the foster parent reported mom was a jerk during their last Zoom call. It's really about how do we get everybody on the same place and how do we help our bio parents work with our foster parents and vice versa, because our bio parents often have difficulty with foster parents because that's not their mom or that's not their dad, and they'll hear things that are happening in the foster home, and we don't want that animosity to build up and build up. So we need to look at all of that engagement for our families and really make it from the point of view of from the child. Did that help answer that a little bit?
A little bit, yeah. But I mean, okay. Our experience is that we often find that foster parents are scared of bio parents, and so they don't want that engagement.
And I think sometimes they are. We're not able to provide every bit of detail that happens in a case to our foster parents. And I think sometimes because of the confidentiality, sometimes they don't know, so they might be making assumptions. But we've really been making pushes on our end to have our families work with our bio families. And I'm not sure if you guys have seen it, but we've had a huge increase in influx in relative placements because we know that's going to be I don't want to say the easiest, because relative placements come with a whole nother level of challenge for boundaries and for our families to work through. But we know that if there's relative placements, that some of those apprehensions aren't there.
Anybody have any further questions for Miss Ashley? I know that we've all been waiting patiently to get this training.
So I would like to know, is it appropriate to ask for the safety assessment at like the IPAC to be used at the custody hearing?
So I think that some of that I might defer to maybe legal, just because those factors should be part of the affidavit, or at least what the concerns were. I don't know here in Bernalillo County if they've asked to have it as like a document that gets used as evidence. I know a lot of times they at least stipulate at custody, but as far as adjudication goes, with the rules of discovery, I know you can get any part of those files with the exception of some of the investigation pieces.
Yeah, it's just whether you get them in time.
Okay.
So I had a question, Ashley, about terms that get used that it seems to me just leave a lot of room. So for example, when you say serious harm, like, are you talking about harm that requires medical attention? Are you talking about harm that leaves any kind of a bruise or a mark? I mean, it just seems like that's so broad. And then also the question of what is imminent? I mean, does imminent mean that it could happen today, or is it broader than that?
So really with imminent, we're looking at within the next very short period of time. So maybe not the next hour, but is it likely to happen in the next day or so? Is it likely to happen in the next 2 days? Like if I walked away for a weekend, is that imminent? Are we concerned that something imminent is going to happen in that time frame? Not in the next month, not in the next like 6 months, like foreseeable future is, but really imminent is that really meddled down piece. I'm going to screen share so you can see for serious injury what the expanded definition is. And again, these aren't all inclusive, but when we're looking at, this is for our caregiver, our danger indicator for number 1, the caregiver caused serious physical harm to the child or made a credible threat. When we're looking at that, we looked at caregiver caused or could have caused a fatality or serious injury. And our serious injury is defined as brain damage, skull or bone fracture, subdural hemorrhage or hematoma, dislocation, sprain, internal injury, poisoning, burn, scald, or severe cut to the point where the child requires medical treatment. So for some of those, in just the initial piece of the safety tool, it might seem vague, but when we look at those beyond that into those definitions, and then even in that item, it goes into more definition for each of those 5 check boxes that you would check during that, for that danger indicator, to explain those in a little bit more depth. And of course, these aren't all inclusive, but those are the bases that we're looking at for serious injury. So it's not my definition of serious injury versus your definition. It's really looking at, and it does say also could have caused, like if I'll give you an example. This is a situation I worked with many, many years ago. A mom pushed her child into the room and the child then fell and hit his head on the bed, like the bed frame and metal frame. So I think in the action, she didn't cause him necessarily, she didn't physically cause his head to hit the frame with her action, but her pushing him in that inappropriate way could have or did lead to the head injury that he had. So in that case, we would look at it for this item to say that was a serious injury. This child had a significant head injury. And it wasn't because mom like smacked him into his bed, but by pushing him and him falling into something else, that is what we're looking at for those types of serious injuries. A parent who uses a open hand to swat their kid as discipline, I'm not going to rate that the same here. A parent who hits their kid excessively to the point that they have marks and bruises on their head or in other areas, it would be different. So we are looking at those expanded definitions in here.
Thank you.
And Corey asked if she's curious if there are any estimations around the extent to which the implementation of the safety organized practices influenced a reduction in case filings in New Mexico.
I don't know that I can answer a 1-for-1 that it has or it hasn't. I can say that in Bernalillo County, we've seen a reduction in the number of kids in custody. Rough numbers, around a year ago, we had over 1,000 kids in custody. At this point, we're sitting around 700, a little over 700. I don't know how much of that is COVID related because we hadn't filed on as many kids. It's really hard to say that just looking at, everything that's gone on this year, what the most influential factors are. I think it has reduced the number of kids that have come into custody. Overall, we started to see that reduction before COVID, but I don't know that it's just the safety tool or it's more of the way we're looking at safety organized practice in those CAP staffings and really looking at what are your danger indicators, what is your risk, what are areas we need more information on, and how can we get to a resolution for this family.
Okay, thank you. And thank you for joining us today, Ashley. We really appreciate it. This is something that we've really been wanting for a while, and So thank you again. I want to remind everyone to fill out the post-session survey, which is posted in the chat. And also, if you're wanting CEUs for today's ECHO session, to email echonmfap@gmail.com to let us know that you are wanting those CEUs. Our next NMFAP ECHO didactic will be on November 17th on medically assisted treatment for substance use disorders, and that will be presented by George Davis, Drs. George Davis and Dr. Andy Heiss. Sorry, I don't know how to say it. But thank you all for joining us today. And thank you, Ashley. I hope everyone has a great week.
Thank you all.
Thank you, Ashley.
You.
Thanks, Ashley.
Thanks, Ashley.